Polycystic ovarian syndrome is a common hormonal condition affecting women worldwide. Polycystic ovarian syndrome can affect a woman's physical and emotional health with irregular menstrual periods, high androgen levels, and ovarian cysts. One of the worst parts of PCOS is reproductive risk, as women with PCOS can manage their symptoms and improve their chances of conceiving with the correct strategies and lifestyle modification. This podcast episode discusses PCOS treatment and fertility optimization. I am Dr. Agnes, and welcome to Talk with Dr. Agnes. PCOS often causes irregular menstrual periods with frequency, absence, or predictability. PCOS individuals may have excessive or prolonged menstrual bleeding. In polycystic ovarian syndrome, ovulatory dysfunction can hinder ovulation, causing infertility. Missing or irregular ovulation is quite common. Hirsutism, acne, and male pattern baldness can occur from excessive androgen production. Many people with polycystic ovarian syndrome can gain weight, eventually becoming obese. There's also insulin resistance, which is common in PCOS individuals. This metabolic state increases type 2 diabetes and cardiovascular disease risk. Besides acne, polycystic ovarian syndrome can also cause skin hyperpigmentation in skin folds like the neck and underarm. This is what we call acanthosis nigrans. Depression and anxiety have been linked to polycystic ovarian syndrome as well. Hormonal imbalance and sleep disruption may also cause weariness. Some people with polycystic ovarian syndrome have pelvic pain, however, this is rare. Management usually starts by taking a detailed medical history. Your doctor will initially ask about your menstrual cycle, hirsutism, acne, hair loss, and family history of PCOS or related disorders. In terms of physical examination, the doctor will check your weight and your blood pressure, and a pelvic examination if needed. Blood tests include hormonal profile or measuring as well testosterone, LH, FSH, and SHBG. PCOS has a high testosterone and LH to FSH ratios, fasting insulin and glucose levels, as insulin resistance raises type 2 diabetes risk in PCOS individuals. Lipid profiles estimate cholesterol and cardiovascular disease risk. Transvaginal ultrasound may reveal small ovarian follicles, as not all PCOS patients have polycystic ovaries. Based on your symptoms and risk factors, thyroid and adrenal gland function tests may rule out other disorders. Lifestyle changes, including dietary modification to include balanced nutrition, for example, whole grains, lean proteins, fruits and vegetables help regulate insulin levels and weight management. So to avoid blood sugar spikes and insulin resistance, prioritize low glycemic index foods. Now, these foods are legumes, nuts, and whole grains. Secondly, regular aerobic exercise like brisk walking or swimming can enhance insulin sensitivity, weight loss, and menstrual cycles. All right. Introduction of strength training exercises help build muscle, burn fat, and manage insulin levels. There's also a role of drugs and treatments, including birth control pills. Oral contraceptive pills can help regulate menstrual periods, prevent unwanted hair growth, and improve PCOS acne. Metformin improves insulin sensitivity and regulates hormonal imbalance in PCOS individuals. Commonly used for diabetic control. Now, there's role for fertility drugs like clomiphene citrate. Now, this drug helps PCOS women conceive by stimulating ovulation. In rare circumstances, laparoscopic ovarian drilling may trigger ovulation by puncturing the ovaries. However, it's usually a last resort. Okay. PCOS support groups and therapy can help women cope and educate and build build a community. In terms of stress management, mindfulness, meditation, and yoga can minimize the detrimental effects of stress on hormone balance. For fertility optimization, you can there's role of ovulation tracking. Fertile days can be identified using ovulation prediction kits for optimal intercourse time. PCOS women must maintain a healthy weight for fertility. Alcohol and smoking can harm fertility, so I would advise to limit them. Consultation with a specialist when natural conception fails, seeing a professional, healthcare professional to discuss assisted reproductive technologies like IVF. In conclusion, polycystic ovarian syndrome presents significant challenges to women's physical and emotional well-being, particularly concerning fertility. However, with lifestyle modifications, medications, and psychological support and optimizing fertility strategies, women with PCOS can effectively manage their condition and increase their chances of conceiving. All right. The key lies in proactive self-care, education, and seeking professional guidance to tailor an individualized treatment plan. By adopting these strategies, women with PCOS can take control of their health and move closer towards achieving their fertility goals. I hope today's discussion has been both enlightening and engaging. Please take a moment to share your thoughts and insights, as they are highly valued, in the comment section below. Now, to stay connected, please follow Talk with Dr. Agnes on Instagram, Spotify, TikTok, Facebook, and LinkedIn, and while subscribing to my YouTube channel. By doing so, you'll ensure that you receive timely notifications whenever new content is released. If you found this information beneficial, consider sharing it with someone you care about, as together we can spread knowledge and promote better health. All right. Now, for any inquiries about my web series or potential collaboration regarding health promotion concepts, please do not hesitate to contact me via email, talk with Dr. Agnes at gmail.com. Until our paths cross again, keep striving to become your best and healthiest version, and I'll see you soon.